Ankylosing spondylitis is an inflammatory arthritis which mainly affects the spine. It can affect other joints as well. So this is the definition of ankylosing spondylitis. Now, patients of ankylosing spondylitis, they usually start with pain in the buttock area. In ankylosing spondylitis, sacroiliac joints are the most common joints which are affected. I'll just show you here with the help of this model. So these are the joints in your buttock area, this exactly here. So these joints are inflamed in the ankylosing spondylitis. So patients usually have pain in the buttock area, pain and stiffness. It's most usually it's like sometimes it's right, sometimes it's left. It can be shifting and alternating pain in the buttock area. Then slowly the pain starts to travel upwards towards the lumbar region, like the low back of the patient, and they can have pain and stiffness in the lumbar region as well. And later on, they can have pain in the back, upper back, and neck regions as well. So this is the main symptom, like the pain and stiffness in low back, buttock area, difficulty in walking, early morning stiffness, like when the patient wakes up in the morning, they feel a lot of stiffness and they're not able to get up from the bed as quickly as they should. Apart from spine, ankylosing spondylitis can affect other joints of the body. It can also affect knees, ankles, feet, and it can also affect hand joints like wrist, finger joints, elbows, shoulders, any joint it can affect, but most commonly it affects spine. So apart from joint symptoms, patient can have other symptoms as well. Some patients, they can have inflammation in the eye, which is called uveitis. They have redness in the eye, their vision gets blurry. And apart from eye, some patients may have inflammatory bowel disease. So there's intestines get affected and there's inflammation in the intestine, and they can experience frequent loose motions. Sometimes bloody diarrhea also they can experience. Apart from this, in some patients, the skin is involved, and when the skin is involved and patients are having psoriasis, at that time it is called psoriatic arthritis. There is a gene called HLA-B27, which we usually test for ankylosing spondylitis. So if this gene is present in your body, you can experience symptoms of ankylosing spondylitis. A family history of ankylosing spondylitis puts you at the risk of getting ankylosing spondylitis. Smoking is again associated risk factor for ankylosing spondylitis. So if someone is smoking, their chances of getting ankylosing spondylitis increases, and the pain also is worse, and the disease is also very difficult to manage if you're smoking. We usually take help of MRI. So MRI of your sacroiliac joints is done to see whether there is inflammation in the sacroiliac joints. So this is the gold standard test for diagnosing ankylosing spondylitis. Apart from MRI, we do some blood tests. Like I spoke earlier, HLA-B27, we test for HLA-B27 gene in your blood. Yeah, these are the main two tests which are used for diagnosis of ankylosing spondylitis. And then we use other tests to, screen your general overall health and to see that other things are going okay. First line of treatment is non-steroidal anti-inflammatory drugs. In common language, they are called painkillers. So the first line of treatment is medical management is a non-steroidal anti-inflammatory drugs. Second, then we use DMARDs. In DMARDs, majorly sulfasalazine is helpful in ankylosing spondylitis. Other DMARDs like methotrexate can also be used in ankylosing spondylitis. There are some injectable drugs which are called biologics. Another major part of treatment is exercise, because exercise helps. Exercise is like 50% of the treatment of ankylosing spondylitis. Many of our patients feel better with exercises. So I recommend doing any exercise of your choice, whatever you like, or any sport of your choice. Patients can pick and they can continue that. in lifestyle modifications, mainly is maintaining your weight, maintaining a healthy weight. So if you're obese or overweight, reduction in weight helps with ankylosing spondylitis. And again, smoking is a major risk factor for inflammation in the joints. So if someone is smoking, we do recommend to reduce and stop smoking. And then a healthy diet and lifestyle where you're eating healthy food, where you're sleeping on time. So all this is recommended for ankylosing spondylitis patients.